Hi, I'm Meg Watson. I'm an epidemiologist in the Division of Cancer Prevention and Control at Centers for Disease Control and Prevention. There are three different types of skin cancer that are the most common types, and those are basal cell carcinomas, squamous cell carcinomas, and melanomas. Now, basal cell carcinomas alone are thought to be more common than any other type of cancer. Melanomas are the third most common type of skin cancer, but they are responsible for the most deaths. They originate in the cells that give skin its color. Skin cancer is very common. Every year, almost 5 million people in the United States get treatment for skin cancer. And this is all skin cancers combined. It costs our country $8.1 billion. Now, most of these are the basal and squamous cell carcinomas. Information on the basal and squamous cell carcinomas are not collected in central cancer registries, so we do get most of our information on them from medical treatment data, and it's important to remember that 5 million is the number of cases treated, not new cases diagnosed. Now, melanoma, again, it's the third most common, but it's responsible for the most deaths. And we see that about 65,000 people get newly diagnosed with melanoma every year in our country, and about 9,000 people die from melanoma each year. The National Cancer Institute estimates that about 2% of people will be diagnosed with invasive melanoma during their lifetimes. Incidence of melanoma has been increasing since the 1970s when we started collecting information on melanomas in central cancer registries. And we've seen that the rate of new cases has doubled from 1982 to 2011. It's one of the most common forms of cancer among adolescents and young adults. Skin type and sun sensitivity are important risk factors for skin cancer. So those with fair skin, those who sunburn easily, or with a lot of freckles and moles are usually at highest risk. However, most important preventable risk factor is exposure to ultraviolet radiation, also called UV. Up to 90% of skin cancers are thought to be caused, at least in part, by UV. The most common form of UV exposure is from the sun, so people can get it while they're outdoors, doing recreational activities, working outdoors, or sometimes people intentionally get UV exposure outside, like sunbathing. Less commonly, artificial UV is another source of exposure that some people get. Sometimes this is related to medical treatment, or certain kinds of occupational exposures, and some people do indoor tanning, which is exposing their skin to artificial UV indoors for the purposes of creating a tanned appearance.